What was your experience like getting diagnosed with diabetes?
Well, it was extremely surprising. Um, those people that know me know I live a pretty active lifestyle. Um, I'm known to spend a lot of time at the gym. Um, it was after I returned from a dental outreach to Nepal that I began to experience symptoms. I was, of course, jet lagged. However, that jet lag seemed to linger for more than a week. I later noticed I became too weak to go to the gym. I had difficulty breathing. I was exhausted just from stretching and warming up. And then soon after that, I began to get up and use the bathroom 5, 6 times a night. I was thirsty all the time. My eyes were so dry that my eyesight was off. I couldn't wear contacts anymore. My skin was so dry that it was difficult to feel things and hold things. It was a strange sensation. I lost 20 pounds in about 4 weeks. I got to the point where I couldn't enjoy things. I couldn't enjoy around my family during Christmas. Um, and then it was at that point that I sort of shared what I was experiencing with a friend of mine who's also a dentist at Brooklyn Hospital and whose father is a physician at Brooklyn Hospital. So I told him what was going on. He said, let's talk to Dad. So we did. And then the next day I went to visit him. We did some tests. And the day after that is when he told me I had diabetes. And he told me my blood sugar was 300. And I was shocked that I didn't even believe the blood sugar could get that high. Later, I found out that it can get a lot higher, especially in type 1 diabetics. But Dr. Butt was kind enough to walk into the pharmacy after that at the hospital, and he waited for me to get my prescription filled. And after that, it was a shock to me. I was really upset. I went home. I admit I cried. I thought, why is this happening to me? How could this have happened? And that was December 31st, 2019. So the next day was 2020, and I started the new year off as a diabetic. It was difficult coming to terms with my diagnosis. I was very much in denial. And in spite of my profession as a dentist, I'm not a fan of needles. So pricking my finger every day and checking my blood sugar and injecting insulin, it was very stressful. That first week I had a couple panic attacks. It was hard to deal with, but it was one of those things where I had to push myself because if I didn't do those things, I wouldn't survive. So that's what it was like.
So did that change the way you approached your day-to-day life, either in your personal life or in your career?
So there's things that we have to do as diabetics. It really flipped my world 180, and it's not something that a slow 180. It was fast. I had to start taking insulin right away. I had to start checking my blood sugar all the time. So yeah, it really changed everything. But when it comes to day-to-day stuff, not just injecting insulin and checking my sugar, but what I have to do is I can't eat as much as I'd like to. I can't have that extra piece of pizza. I can't snack as much. I can't have that little extra without taking more insulin. So it's frustrating, and occasionally I will get low, and it's almost as if every meal is like a math problem. Like, how many carbs is in this meal? How much insulin do I take? If my blood sugar drops too much, that puts me at risk. And then if my blood sugar gets too high, that puts me at risk as well. So there's a fine line between what's right, what's wrong. But that's something that I've had to learn and had to deal with. There's been times where I've woken up in the middle of the night sweating. It feels like a panic attack, but it's my blood sugar has dropped too low. Then I'll have to go to the kitchen or something to have something to drink or to eat to take care of it. It's an emergency, but it's something that happens once in a while. Yeah.
Wow, that's a steep learning curve. I have really severe food allergies myself, so I can't even imagine the thought, like what you're saying about food, I don't even think about, and I could not imagine doing that.
It was so much things I had to think about now. You can't. Yeah, it's a lot more to think about. I have to be conscious of stuff all the time. It's totally changed the way I live. But that's how it goes.
So you said you got diagnosed end of 2019. So you started off 2020 like this, and obviously we all know how 2020 has gone. But did your experience change, even though you really only had a few months pre-COVID? But did it change at all once, the pandemic started, for lack of a better phrase?
It did. Since we got hit so hard in New York, it did change. I do have a background in public health, so I was sort of keeping up with the story that was going on in China. So that was interesting. And then when it came to New York, I thought it would be like what we had with Ebola a couple of years ago, where just a few people had it. It didn't really get that big. But once I started learning more, I was scared. To be honest, I was pretty scared because it took a few months before my blood sugar was controlled. And I heard that people who have diabetes are more likely to be at higher risk and to have more severe form of the disease and to actually die from it, especially those who are not controlled. And since I was at that stage, I was scared. I did have N95, and I would go to the grocery store with an N95 at the time. But I was scared. And on top of that, dentists are one of the highest risk professions because we see so many people because of the aerosols that we produce. So yeah, I was scared, and I live right by the hospital. So I would see those refrigerated trucks that house the morgue overflow. So it was very real for me. But it was also a motivation to get on track, make sure that my blood sugar was stable and controlled, and I wanted to reduce my risk of exposure. So it was motivation as well.
Do you have any words of advice to anyone with diabetes in general, or words of advice of how you've dealt with diabetes during COVID?
Don't give up. Don't lose hope. With diabetes, it's never easy. It's always frustrating. You may think you have it under control, and the next day, for no reason at all, the blood sugar will spike. And that happened to me today. I woke up, my blood sugar was 150, and I have no idea why. And things like this happen once in a while. And diabetics are what I've learned from after being diagnosed. I learned a lot, but diabetics are more likely to develop depression and anxiety. But I hate that see that get the better of people. But no matter what, we have to take care of ourselves. We have to stay safe. Alternatives are pretty awful. Just for diabetics, amputation, kidney disease, that type of thing. And then with COVID, we're high risk for dying. So we have to stay on track. And I hate saying this because it's kind of cliche, but having a good support system really is necessary. I couldn't have done it without the support of my family, my friends. It's not an easy condition to live with. It doesn't go away. But you can't do it alone. You have to have people around you that are helpful. I learned, I sort of turned to social media a lot. I learned a lot through Instagram. And one term I learned is diet buddy, which is like friends that have diabetes. And if anyone out there is having a rough time, they can always reach out. I can be someone's diet buddy.
So to start off,